The healthcare reform will change organizational management because it will affect the way our current system is operating. The healthcare reform is complicated due to its detailed explanations of things such as cost and coverage. Here are some of the current problems.
Health insurance is expensive. The average American family pays $14,000 a year for coverage. Due to the expense, more than 1/7 of people do not have coverage. A smaller percentage can only afford the bare minimum, which may or may not cover what is needed.
Pre-existing conditions such as asthma, cancer, and heart disease are not covered when you're looking to purchase insurance for the first.
Good morning. How are you today?
Good.
What can I help you with?
My daughter needs health insurance.
Okay, great. I would love to help you. Do you have any pre-existing conditions?
Yes, she has asthma.
Oh, I'm sorry, but I cannot provide you coverage. Now that you know some of the problems, here are a few of the proposed solutions.
To start dealing with cost, insurers will be limited in how they spend our premium dollars. If they use too much for administrative costs or profits, they'll be forced to give some of it back through rebates. This won't stop premium increases, but it may help some.
Lots of preventive care such as vaccinations and screenings for private companies and Medicare will become free.
Reform will make it illegal to turn down kids for pre-existing conditions.
She's just a child.
How old are you?
I'm 10.
Oh, well, by law, we are now required to help you.
Yay!
People over 65 will be given more support paying for their medications. Younger people will be allowed to stay on their parents' insurance until age 26, and small businesses will get tax breaks to help them pay for their employees' insurance.
High-risk people who are uninsured will be given the option to enter a high-risk pool, which is more risky for insurance companies, but is financially covered by the government.
Which could be a whole other problem.
Medicare will be expanded to cover all low-income families and individuals.
Tax credits will be given to people who lose their jobs or are not given insurance from their employers.
Businesses will pay larger fines if they do not insure their workers.
So before we finish up this interview, do you have any questions?
Yes, I was just wondering, what type of health insurance would I get if I was employed here?
Oh, we don't offer our employees health insurance.
Oh,
I'm from the government and you'll be fined for not providing health insurance to your employees.
people who are not covered by their employers can go through a system called the exchange, which offers a variety of coverage explained and broken down in the following clip.
An exchange is like a virtual insurance mega mall. Based on where you live, you'll get an easy-to-understand menu of options to compare plans in plain English, and the exchange makes sure insurance companies compete fairly under strict rules. The idea is that by giving consumers good information, a fair playing field, and access to lots of choices, competition among insurers will keep rates competitive.
Okay, that's right.
Insurance companies will no longer be allowed to turn people down or charge more if they are sick.
By 2019, 32 million new people will be insured, but 23 million uninsured will be mostly made up of the undocumented immigrants.
All this is going to cost money, $938 billion over the next 10 years, according to the Congressional Budget Office, the impartial referee when Congress debates these kinds of things. It's a lot of money, sure, but if you look at it another way, it's 2% of our federal budget and 3% of what we'll be spending on health care overall. Now, the President and Congress insisted these new costs will be paid for so they don't push the budget deficit up any further. That means money will come out of someone's pocket. That's where the tough politics come in. A lot of savings will come from health care providers and insurers in the Medicare program. The fees the government pays to hospitals under Medicare won't be allowed to rise as fast as they have been. And insurance companies that provide services to people on Medicare will be paid less. Medicare will also create a bunch of experiments around the country to test different ways of paying doctors, hospitals, and other providers to make the healthcare system more efficient and improve the quality of care. With luck, some of these experiments will work and then be adopted by the private sector and help lower costs for employers and families, too.
In the future, people will not have to go to the hospital to see their doctor. Patients will be able to utilize technologies, such as Skype, to ask medical questions about problems they may be having.
Oh, I don't feel good. I need to call my doctor.
Rachel. How can I help you today?
Oh, I don't feel good. I have a headache and feel nauseous and a cold and can't eat anything.
Oh. Oh no. Well, judging from your symptoms, it sounds like you have the flu. I recommend you get plenty of rest, drink lots of fluids, and you should be better within a few days.
Okay. Thank you, doctor. I appreciate your time.
No problem. The reform will affect healthcare managers because it will require them to continue learning constantly and to keep up with the ever-changing healthcare system and laws.